Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around your pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today, we're going to be continuing our menopause series and talking about the symptoms of menopause. So if you hadn't seen the first video, go back and watch that one so you have a little bit of context about what we're talking about today. When we will start talking about symptoms.
Yeah.
Okay, so what is typically the first symptom that people might notice if they're in perimenopause or in menopause?
Yeah, so usually the very earliest sign of perimenopause is that people start having changes in their menstrual cycle. And what we mean by that is it might be that the length between their periods changes and fluctuates. It might be shorter or longer. Also, the bleeding that goes on with periods can change. So maybe it's heavier or lighter, or the number of days that you're bleeding changes too. So just a lot of changes in your menstrual cycle when in the past it might have been a lot more regular for you.
Mm-hmm. I think the one that I hear about most frequently, just in the general media and life, is like hot flashes.
Yeah, hot flashes are big in perimenopause and probably the most distressing symptom that some people can experience, and they're really common. And so hot flashes can happen during the day or they can happen at night, which we refer to as night sweats, because people will wake up just drenched in sweat and sometimes have to change their clothes, change their sheets. Your body is just not regulating temperature like it used to.
Oh, I'm not looking forward to that. Okay, we both have kids. Do you remember after delivery having those?
Yes.
Oh, yeah. So if you've had a baby and you've had the night sweats after the baby, that's sort of what hot flashes are described as.
And they'll eventually go away once you're done with perimenopause and menopause.
And then changes in vaginal tissue related to your body knows that it's not going to be used for reproduction anymore. So your vagina essentially becomes not prioritized by your body.
That's a good way to put it,
right?
Right? Good way to put it.
So you could experience dryness, which can associate with other things, right? So the difficulty with sex is related to dryness. UTIs are associated with the vaginal dryness. So if you treat vaginal dryness with vaginal estrogen, you may decrease the likelihood of having a UTI. There are changes in the anatomy of the vagina. So it shortens, thins out,
narrows. You can also have uterine prolapse, where the top part of your vagina kind of comes down or even comes out of the vagina. That happens for some women.
Yeah.
And so as a result of that too, a lot of women can have leakage in their urine with running, jumping, laughing, all those things that can get worse around the perimenopause.
So osteoporosis can occur. So it's really important if you're younger to start doing weight-bearing exercise to prevent osteoporosis in the future. Just an extra tip.
Yeah, cognitive functioning can change around this time, so people can feel like maybe their memory's not as good or they're just not thinking as fast, and that usually gets better too as you go through menopause.
Sleep changes, separate from the night sweats, right? Night sweats are going to interrupt your sleep too, but you can also have difficulty falling asleep or staying asleep, or just the duration of your sleep or the quality of your sleep is not as good.
You can also have decreased in your libido, meaning your sex drive is not as high as it used to be, or your interest in sex is not what it used to be.
And I think related to what we talk about the most is that you might have either worsening or new onset of symptoms of depression or anxiety.
Yeah, so there's a 16% prevalence rate of new onset depression, meaning these women have never had depression in their lives before, and all of a sudden they start having depression symptoms. And we can see that with other mental illness disorders too. So sometimes with schizophrenia or bipolar disorder, these things can show up in perimenopause when people have no history of having those symptoms before.
So as you can see, it's a really life-altering, physiologically altering time. So, just really.
Another wonderful thing that women get to go through.
So if you're experiencing any of those things, talk to your doctor about what your treatment options are. And in our next video, we're going to be talking about the treatment options that are generally considered around this time. Thanks for being here. Please like, comment, subscribe. We'll see you soon.
Bye.